Chronic Obstructive Pulmonary Disease, commonly known as COPD, is a prevalent lung condition that affects millions worldwide. It primarily impairs the lungs and restricts airflow, making breathing a laborious task. The disease is progressive, meaning it worsens over time, and predominantly affects middle-aged and older adults. Despite its severity, many individuals are unaware of COPD until it reaches an advanced stage. Understanding COPD is crucial because it significantly impacts the quality of life and can lead to other health complications if not managed properly. COPD is not a reversible condition, but with the right management strategies, individuals can lead a relatively normal life. Education about COPD is vital so that symptoms can be recognized early and appropriate treatment can be started. By understanding what COPD is, how it manifests, and how it can be managed, individuals can seek the right medical help and make informed decisions about their health and lifestyle. The primary cause of COPD is long-term exposure to substances that irritate and damage the lungs, with cigarette smoking being the most significant culprit. Approximately 85 to 90% of COPD cases are caused by smoking. Even individuals exposed to secondhand smoke have a higher risk of developing COPD. Apart from smoking, other environmental factors also play a crucial role in the development of COPD. Long-term exposure to air pollution, dust, and chemical fumes in workplaces can also contribute to the onset of this disease. Individuals working in mining, construction, or factories are particularly at risk. Genetic factors also contribute to the development of COPD. A deficiency in a protein called alpha-1 antitrypsin, AAT, is linked to about 1% of COPD cases. Understanding these causes can help in taking preventive measures, such as quitting smoking and reducing exposure to pollutants. COPD symptoms often do not appear until significant lung damage has occurred, and they usually worsen over time. The most common symptom is an ongoing, persistent cough, often referred to as a smoker's cough. Breathlessness, especially during physical activities, is another significant symptom that tends to get progressively worse. As the disease progresses, episodes of wheezing and chest tightness can become more frequent. Many patients also experience frequent respiratory infections, which can exacerbate the symptoms. Fatigue is also common in individuals with COPD, as the effort required for breathing is significantly higher than that of a healthy individual. This can affect the ability to perform daily activities and can lead to a decrease in physical activity, which in turn can exacerbate other symptoms and overall health deterioration. Weight loss and muscle wasting are also common as the disease progresses, reflecting the advanced stages of COPD. It is crucial for individuals experiencing these symptoms to consult a healthcare provider for an accurate diagnosis and appropriate treatment. Early detection can help manage symptoms more effectively and improve the quality of life. Diagnosing COPD involves several steps, primarily focusing on lung function tests to assess the extent of blockage in the airways. The most common test used is spirometry, which requires patients to blow into a tube connected to a spirometer. This device measures the amount and speed of air a person can exhale, helping to determine the presence of airflow obstruction indicative of COPD. A physical examination is also performed, during which the doctor listens to the lungs with a stethoscope for any abnormal sounds. In some cases, a chest X-ray or CT scan may be recommended to visualize the structure of the lungs and rule out other conditions. Early diagnosis and regular monitoring of lung function are critical for managing COPD effectively. These diagnostic tools not only confirm the presence of COPD, but also help in determining the severity of the disease, which is crucial for planning appropriate treatment and management strategies. While COPD is not curable, there are several treatment options available that can manage symptoms, reduce the risk of complications, and generally improve the quality of life for those affected. Pharmacological treatments include the use of bronchodilators, which relax the muscles around the airways and make breathing easier. These are typically administered via inhalers and can be short-acting or long-acting. In addition to bronchodilators, inhaled corticosteroids can be prescribed to reduce inflammation in the airways. For patients with frequent exacerbations, a combination of these medications is often recommended. In more severe cases, oxygen therapy may be necessary to ensure that enough oxygen reaches the organs. Other treatments can include pulmonary rehabilitation, a program that combines exercise, education, and support to help patients improve their physical and emotional condition. Lifestyle changes also play a significant role in managing COPD. Quitting smoking, avoiding lung irritants, and maintaining a healthy diet can help mitigate symptoms and slow the progression of the disease. Living with COPD requires adjustments to daily life, but managing the condition effectively can lead to a better quality of life. One of the most important steps is smoking cessation. For those who smoke, quitting is the most effective way to stop the progression of COPD. Regular physical activity is also crucial. While it might seem counterintuitive for someone with breathing difficulties, exercise can significantly improve lung efficiency, muscle strength, and overall well-being. Pulmonary rehabilitation programs offer structured exercise plans that are safe and beneficial for COPD patients. A healthy diet is equally important. COPD can cause weight loss and muscle weakness, so a well-balanced diet rich in proteins, healthy fats, and vitamins is essential. Staying proactive in managing health can make a significant difference in the course of the disease. Recognizing the signs of COPD early and consulting a healthcare provider promptly can make a substantial difference in managing the disease. Early intervention can slow the progression of COPD, minimize lung damage, and improve quality of life. It is crucial for individuals at risk or those experiencing symptoms not to delay seeking medical advice. Continued medical follow-up is important as COPD requires ongoing management. Regular checkups allow for adjustments in treatment based on how the disease is progressing. The impact of COPD on an individual's life can be significant, but with the right approach to treatment and management, it is possible to live a fulfilling life. Knowing about the disease, its causes, symptoms, and treatment options can empower patients and their families to take active steps in managing the condition effectively. With the right medical care, support, and lifestyle adjustments, individuals living with COPD can maintain active and rewarding lives.